Hi there. Welcome into the clinic. My name is Kate. Very nice to meet you. Please sit down. Yes, is that seat comfortable? Okay, great, because for the entirety of today's session, you will be sitting, okay? So please let me know right now if you need any adjustments made. You're good? Okay, great. So, nice to meet you. As I just said, my name is Kate. Welcome to the clinic. We are not your typical doctor's office since we don't practice traditional medicine, but of course, traditional medicine is very important. What we kind of do here today is homemade remedies, right? Yes, homemade remedies. So I apologize if I slip up on my words. I'm getting over sickness. I do very much apologize. So, homemade remedies, right? So I'm assuming that is why you're here today. Okay, yes, sometimes we do get some individuals that kind of wander into the clinic, assuming that we practice traditional medicine here, and I have to send them on their merry way out the door, since none of us have a degree in anything special. We just kind of come here to do work and help those that have been struggling to find solutions elsewhere. So I hope I can find some solutions for whatever issue you've been having today, okay? Great. So just sit back and that's it. I'm just going to make some adjustments for you, okay? Okay, great. All right, so let's see. Can I get a name for you? Okay. Is that spelled with an A? Okay. All right. And can I get your date of birth? Okay. And can you describe the issue that you've been having? Okay. So has this been occurring mainly around your nose or ears or eyes, mouth, forehead? Okay. And you're not sure why the aching is occurring, okay? So you have gone to a doctor about this? Okay. What did they say exactly? Okay. All right. Yep, I understand. So sometimes solutions can be easier than we initially believe, so I hope I can find that easy solution for you, okay? So today I will be mainly doing various examinations, and after today's session we can proceed with the homemade therapy, okay? Okay, great. Alright, yeah, luckily we don't need any insurance since none of us are real doctors. So no insurance card necessary. So this will be out of pocket, but don't worry, our prices are very normal. It's like getting your nails done, or I guess if you don't really know what that's like, getting your eyebrows done. No, it's just kind of like a complimentary service, you know, it's nothing, cosmetic, not complimentary. Complimentary would mean free. It's not free. My apologies. Okay, let's begin. All right. So I'm just going to use this glove really quick. Don't worry, my hands are clean. I'm just going to feel on various parts of your face, okay? Actually, you know what? Your hair is kind of long, so just look right at me, okay? I'm going to just put this right over your head, okay? This is for your hair. If your hair is even slightly longer and may get in the way, such as like below your hairline, honestly, the only people that don't need the headband are bald. So if you're not completely bald, then the headband's necessary. I'm not trying to call your hair like super long or in the way or anything. Okay. Because your hair looks amazing. Okay, so now I'm just going to take this glove. I'm just going to feel on various parts of your face, okay? So just look right at me. Okay, try not to move your head, alright? close your eyes for me? Thank you. I'm just gonna put some pressure on your eye. Okay. The other eye. Okay, now I'm just gonna feel along your nose, alright? Yeah, please breathe as normal. Yeah. Thank you. Okay. I'm just gonna come around over here really quick, okay? Can you feel my hand on your eyebrow currently? Okay, just making sure. I'm gonna feel down your throat, okay? Breathe as normal. All is well. Yes, my gloves are very loose. We ran out of the ones in my size. I do apologize, but that's all we have today here. And honestly, it's not a big deal. Big enough deal, at least, to run out to the store super quick. Okay. Can you gulp for me? Yep, just gulp. Okay, very good. All right. So now what I'm gonna do is I'm going to use this and put the vibration on various parts of your face, okay? And you're gonna tell me where you feel the vibration, okay? So close your eyes. Thank you. Forehead, good. Okay, again. Nose, good. Okay, again. Cheek, good. Okay, again. Chin, great. Okay, again. Eyebrow, good. Okay, again. Other eyebrow, good. Okay, one last time. Back of your head, very good. Okay. Great. So now you can open your eyes. I'm just going to look into your eyes, okay? So look at this light right back here for me. Look right at this light, okay? Look right at this light. Can you see it? Can you see the light? Good. Okay. Let's go on the other side as well. Can you see this light? Can you see it? Yep, keep looking at the light. Follow it if you can. Okay, very good. Alright. Now, just going to look in your ears. Okay, now in the other ear. Okay, great. Right. Now, going to look in your ear without the light. Okay, in your other ear without the light. Okay, can you open your mouth for me and say, Okay, good. Open your mouth for me once more and say, Keep it open. Keep your mouth open for me. Okay, very well. Alright. Now, I'm just going to take a deeper look at your face, alright? Just going to examine your pores, okay? So, I'm just going to take a look at your pores. Take a look, take a look, take a look, take a look, take a look. Take a look, take a look at your pores. Okay. Did you use a pimple patch recently? Okay. Yeah, this thing is really tight. Okay. So now, what I'm gonna do is I have this soft brush here. Feel that? Okay, know that feeling as dull, okay? Now I have this tool right here. It's going to be a little bit sharp, okay? Does that feel sharp? Okay, so keep your eyes closed and tell me whether or not you feel the dull or soft feeling and the sharp feeling. Tell me which is which, okay? Soft is dull, sharp is sharp, okay? Okay, let's begin. Soft, good. Sharp, good. Sharp, good. Sharp, good. Soft, good. Dull, good. Dull, good. Sharp, good. Sharp, good. Sharp, good. Dull, good. Dull, good. Sharp, good. Dull, good. Sharp. Sharp. Dull. Dull. Okay. Good. Alright. So now I think I'm going to have to take a skin sample. If that's alright. It's going to be a very small portion. Do not worry. Okay. So, what I have here is an antibiotic. So it should allow me to take a small skin sample. Okay, so it shouldn't hurt, alright? I'm gonna put a numbing cream on after this, okay? So just hold still, hold still, hold still. I'm gonna take it from this problem corner, okay? Because when I did the dull and sharp in this corner, this is where you kind of lost feeling, okay? Alright. Good. Okay, and now I'm just gonna put some of this numbing cream on you, okay? Just some of this numbing cream. Okay. Just going to put some of this here. Excuse me. Just going to put the numbing cream here. Okay. Alright, very good. I'm going to take this glove off now. Okay. Just going to wipe it off of the areas that weren't heavily affected. Okay. Just going to color that right there. Alright, as an indicator for me. Alright, actually, really quick. Can you feel that? Okay, good. That means it worked. Hold still. I'm just going to take a small skin sample. Okay. I'm just going to remove that. Okay. Very good. Can you do me a favor and can you just put this right here on your face? Thank you. Very good. All right, great. So your skin sample has been taken. So now I'm just going to quickly take this off. Okay. So let's do a quick recap, okay? So while feeling along your face, I'm going to feel along your face as I describe this to you. I felt a buildup of pressure around here on your nose. Does that seem familiar to you? Just going to mark right here. Right here. Okay, build up. That seems right. Okay. Build up of pressure near nasal cavity. Okay. And what I also saw was that right here you lost feeling completely right above your eyebrow, okay? Yeah, so that's why I took a skin sample and we're gonna look at that underneath the microscope, okay? Okay. Alright. Now, when I looked into your eyes, I saw that there was a bit of an inconsistency with your pupils, okay? So that can indicate mental unrest. Has life been very stressful recently? Okay. Yeah, so sometimes our pupils can dilate differently, or our iris can dilate differently, our pupil can dilate. Honestly, any of the lingos running the eye, the big black thing in your eye, yeah, that is what is dilating incorrectly. And there's an inconsistency in that, which is what's causing me to feel unease about your mental state, okay? Does that seem to latch on? Okay, you've been stressed. What has been stressing you out? Okay. Have you been sick recently, or has someone near you been sick? Okay. Yeah, so if someone near us has been sick, sometimes that can cause a buildup near the nasal cavity, especially if it's something like a head cold. Yeah, it's been going around. Yeah, everyone I know has been sick. Or like with something, but a bunch of different things, One of my friend, I think she has strep. Another, I think the flu. All horrible, I have to say. Another, a head cold. So everyone's been getting sick. Okay. Alright. Even myself. Okay, so from what I'm seeing, with the buildup of stress from your personal life and some sicknesses that have been going around, that I think, based on the stressors in your nasal cavity, I hate to say it, I think you're going to have other symptoms in, say, a day or two, because that's usually the first signs that we see. Yeah, so get prepared for that, whether it's mentally or physically, get yourself some medicine. And also, I do think you have some disturbed nerve endings above your eyebrow, okay? Yeah, so for the disturbed nerve endings, I am going to look at the skin sample, okay? See what I can see underneath the microscope. But for the disturbed nerve endings, I would go to a traditional medical physician for that solution, okay? When stuff related to stress and mainly the stress factor, we can fix that here through therapy, not talking it out, but through other means. Since, once again, not a therapist, but we have other home remedies that relate to stress that we can do for you. So some may be more yoga related, or activities like that we can do that help with relieving stress in that way to fix the disparity that I saw in your eyes. Let me just double check that really quick. I want to make sure I'm not misdiagnosing you. Okay, yeah, I'm just gonna go in real close. Yeah, no, definitely stress. Oof, bad case too. Okay. Alright. Yeah, go to a traditional doctor for the nerve ending issues, since that is not something that we can help with. And for the traditional sickness, you may be getting cold, flu, strep, any of those, anything really, but I can tell something is going to happen soon because of the buildup in your nasal cavity. But once you're over that, come right back here and we will do those exercises to relieve the stress, okay? Alright, thank you so much for coming in. I hope that this wasn't too stressful. And the bleeding should have stopped, so I'm just going to take that from you. Thank you. So thank you so much for stopping by. It was a really small skin sample. I know it seems like a lot, but it was really small. You should be all good. Thank you so much for stopping by. I really do appreciate it. If you need any more help, please talk to Sarah out front. She can give you any further instructions, or if you have any more questions, please feel free to ask me them right now. Nothing else? Okay, great. I really hope to see you again. But, you know, if the stress relieves itself on its own, I'm so happy for you. But if not, we can do those exercises next time we meet. Okay, yes, it was really nice meeting you. Okay, bye now.